Hi, I'm Dr. Erin. I work at HerHealth at Washington Regional Medical Center, and March is Endometriosis Awareness Month. Endometriosis is an overgrowth of the inside lining of the uterus that is implanted in places other than the uterus. It creates a cyclic inflammatory response that can happen once a month that over time could create chronic inflammation, that could lead to chronic pain or scarring within the pelvis, that can cause other complications. Endometriosis, like I said, typically presents as pain. However, it could be a cyclic pain. It could develop into a daily pain due to the degree of inflammation that happens with endometriosis. However, a lot of times it could be specifically a patient complains of pain when they're intimate with their partner or pain with intercourse. And patients will describe a specific type of pain during that moment that can kind of trigger me to wonder if they are dealing with endometriosis. Other times patients will describe a lot of discomfort when they have a bowel movement, really specific when they're on their cycles. That can also be one other thing that makes me kind of wonder, are they dealing with endometriosis implants lining their colon or lining the posterior or the backside wall of their pelvis that could create a lot of discomfort. Another side effect that can come with endometriosis is actually women can deal with infertility. I mentioned pain that comes from chronic scarring and inflammation along the pelvic lining. However, the pelvis is your tubes are part of that. So if your tubes are affected by that chronic inflammation, we think that could be an etiology for infertility as well. The classic way to diagnose endometriosis, unfortunately, is surgery, where we place a camera inside of your belly and we actually see implants of endometriosis in your tummy. Oftentimes your physician will go over your symptoms, your medical history, and we clinically will think that you have a high suspicion for endometriosis. So we may treat you accordingly. Otherwise, we may be taking a lot of women to surgery and it may not actually be indicated for their management process. There are a host of ways we can treat you. Sometimes it's just treating symptoms alone, using medications like ibuprofen or Aleve to control some of the pain that comes with your period. It could be managing your period with some type of a hormonal management. A go-to typically is a birth control pill that can help stabilize your menstrual cycles. Sometimes it involves using a shot that can help stabilize your hormones so that they are not fluctuating quite as much. Therefore, the endometriosis is not fluctuating quite as much and creating as much inflammation. Sometimes surgery is an excellent way to treat it. We can actually excise the lesions and remove it. Sometimes there are other hormone management ways that actually suppress all of our hormones completely. I recommend that a patient go see their gynecologist every year, and I have my patients follow up here at HerHealth whether they're having problems or not for a preventative exam.